Hey, this is Matt at Competitive Edge Physical Therapy. We're going to go over a video series talking about shoulder instability. So this video will be on what is shoulder instability, who does it affect, and our future videos will talk about where treatment usually goes wrong for shoulder instability, where you don't get the outcomes you want, as well as how we treat it differently here and help you get the outcomes that you do want. So what is shoulder instability? Shoulder instability is a pathological condition. It shouldn't be confused with joint laxity, which is just too much motion in the shoulder, but it's too much motion in the shoulder because of a compromise of some of the tissues around the shoulder that's leading to either pain, a decrease in performance. So you're going to get baseball players talking about they can't get that fastball up where it used to be, tennis players feeling like I can't be consistent in my serve, not hitting that same spot every time, or just a general feeling of my shoulder feels heavy and it just feels like it's moving around all over the place. So really, the shoulder has some passive structures, which are the ligaments, the labrum, and the bone itself. Those could be compromised, allowing too much motion into the shoulder, or it could be due to the muscle dynamic stabilizers around not having the muscular support, the rotator cuff, to hold that ball on the fossa, the shoulder blade there. So when you look at who it affects, it really affects younger, athletic, active individuals, especially if they're playing overhead sports that are repetitive in nature. So that's going to be your tennis players, your volleyball players, your baseball players, things like that. If you look at the one-year incidence rate, it's about 3% in active individuals. I mean, about 3% of the population are going to get it in a year. If you look at college athletes, about 10% of college athletes have shoulder issues, and 25% of them are due to shoulder instability. So it's an issue you definitely will see, and you want to make sure that it's diagnosed correctly and treated correctly, because it could definitely be tough sometimes. So when you're looking at the different causes, there could be two main types. So it could be due to trauma. So someone's had some sort of position where the shoulders actually come out and dislocated or subluxed. So out in the front where there's shoulder abduction, external rotation, or sometimes a fall onto an outstretched hand in which the shoulder tends to go out the back. So that would be traumatic, and sometimes you have atraumatic. So it's just from overuse. Some people are born, you might see that on both shoulders tends to happen, versus traumatic really is just one shoulder due to a car accident, something like that. Then you also want to look at the severity of it. So there's kind of three different types there. There's an actual dislocation of the shoulder. The shoulder has come out of the socket and it's requiring some assistance to get back into the shoulder socket. You have a subluxation where the head of the humerus comes out of the socket, but then will just naturally come back in without anyone help. And sometimes you never get it out of the shoulder socket. You just have some micro instability of the shoulder moving around too much on that glenoid fossa. And really with all those, you want to make sure you know what the event was and also the direction of the instability. So you can have a couple different directions. You can have shoulder instability in the front of the shoulder, so the shoulder tends to come out front. You can have posterior instability where it tends to go out the back. You have inferior instability where the shoulder might come down out of the socket, or you might have multi-directional instability, which is two or more of those in any given direction. So really, to make sure you diagnose this correctly, you want to spend enough time, go through the history, find out what's causing it, which direction it is, and get all those things. Because if you're not getting which tissues are actually getting stretched out, you're not going to know what treatment it is. And that's really what makes us a little different at Competitive Edge Physical Therapy. Our hour-long evaluation time gives us plenty of time to ask all the questions: where it happened, how it happened, what sport you're playing, what's your activity level you need to get back out to, as well as all the equipment, our EMG feedback for looking at the muscles, seeing how they're firing, if it really is a rotator cuff issue, scapular stability issue, and the training to make sure that you get that back in. So if you have any more questions about what shoulder instability is, or who it affects, or how you treat it, feel free to give us our clinic a call here in San Jose. Come check us out or visit our website at compedgept.com. Thanks.